just some brochure put on here if you feel free to get them. Just introduce myself first. Sorry, I'm not quite familiar with this. My name is Rain. I'm Chinese. I was born in a Chinese medicine family. I'm the fourth generation to practice acupuncture. My grandfather, he was famous by treating breast cancer by needles. I studied acupuncture in Beijing University of Chinese Medicine, and I was majoring in acupuncture and tuina. Tuina is kind of Chinese manipulative therapy. And after I graduated from Beijing Uni, and I start practice in Beijing, and later on I met a supervisor. He is an osteopath, and I found out we quite have similar principle. And I'm curious, so I come to New Zealand to study osteo. And after I study osteo, I find out more why people confuse acupuncture. So today I'm going to tell you, use the language which you can understand. I've been practicing acupuncture for 15 years, 6 years in Beijing and 9 years in Auckland. So here, this is, I'm going to show you a video on the right side. This is a common video, exactly every day, how people go to see acupuncturist. And you can see a lot of people waiting in the queue to make appointment with a Chinese doctor. And after they get their receipt, and they go upstairs, and they get into the treatment room. You can see on the left side, a lot of people lying on the table. You can see a lot of people lying in a room because we have too many people. So you can see people doing cupping and doing needles. So that is exactly every day in China. And we have acupuncture department in our public hospital. We also have Chinese medicine hospital. So the whole hospital is about Chinese medicine. We have acupuncture, we have tuina, we have herb medicine, we have dietary. So the complete Chinese medicine system. And I'm going to show you, this is New Zealand. Sorry, I can't show you which clinic things. But according to ACC, there were over 1,200 acupuncturists in New Zealand. And we have 2 acupuncture schools. They are both in Auckland. And we have Chinese Medical Council, and I have Acupuncture and the organization. So acupuncture is quite being used either in China or in New Zealand. So I want to ask a question. How many of you today have received acupuncture before? Oh, a lot of you, eh? But if you receive acupuncture, can you explain how that works? It's difficult, eh? Because after I understand osteo and I learn anatomy, I learn physiology, yes, we do learn that in China, but my thinking about acupuncture has changed. So I kind of stand on your position. I feel, how can I make that sense to Western who hasn't learned Chinese culture, who hasn't learned Chinese language? How can they understand acupuncture work? So today, I'm going to use the language make you understand that. The first thing is about professional barrier. Similar on the right side is about Western medicine. We're talking about hypertension, that means high blood pressure. We're talking about myocardial infarction, that means heart attack. Similar in Chinese medicine, when you're talking about qi, that means vital energy. When you're talking about shen, that means spirit. That means how is your mind. It's difficult to understand in this professional language. So that is one of the reasons you couldn't understand. Another thing is about Asian language. So the right side is about Shakespeare time English. That means nothing to me. Even though I learned English over 10 years, or over 15 years, I still can understand what they're talking about. So similar like when people study Chinese medicine, this is Chinese medicine. Currently, we have over 5,000 years. When you learn this, even when Chinese people learn this Asian Chinese, it's difficult for us as well. So I understand why you couldn't understand it. And another thing is about language is limited. So when some people teach me about acupuncture, even though we are both Chinese, they cannot always find out the words describe how they're feeling. And then you're going to feel when you go to do acupuncture, you feel the needle on your body, but how you describe that feeling? Sometimes it's a little bit deep, achy, sore, but actually not like that. It sounds weird. So people use, language itself is difficult. So today, if you understand the Western medicine, you're going to understand what is a bioelectric transmission. If you don't understand, fine. I'm going to introduce this. On the right side is about how these potassium, sodium, these chemicals transfer inside of the cell membrane and outside the cell membrane. If you're thinking about two cells, they transfer signals by electricity. And that means our body is full of electricity. So when we transfer our signals to the brain, we use electricity. We transfer the heart, we use electricity. But this electricity is invisible. And then when people talking about doing acupuncture, they work on the nerve, yes, but we are more talking about energy flow. And that means the energy is invisible, but it exists. So if you see, you feel your heart jump, that is electricity. Your breathing is electricity. And then even your touch, when you touch something, that transfer electricity to your brain, tell you it's a sharp feeling, it's dull feeling, or it's just a pain and you get off the hand from the danger. And also the digestion. It is electricity in there as well. And about the brain, where brain signal. So it's all about electricity, it's all about energy. This is the difference. I find out in the article we start to use different language but actually describe the same thing. In Chinese medicine, we understand that the body, we are energy. And in Western medicine, we understand from biology. It's different, but actually same. We study human body. We don't have two human body. The human body is same. We use different language to describe the same thing. When you go to see Chinese doctor, we're going to do observation. So we're going to see how is your face look like today. Is that pale? Is that red? Is that a little bit upset or angry? We can feel the emotion and we can observe, are you feeling well today? And also we listening, when you talk to us, we can tell from your talking, is your speech is strong or you kind of waving, we couldn't hear you much. That means how level your energy is. And also we test your pulse. From the pulse, we can tell how is your body happen. And the pulse is kind of physics. I'll tell you that. If you're thinking about the river, and that is the artery in your body, the river like an artery, but when the river is go flow, and you feel good. But if thinking about inside the river, there is some mud. How is the river goes? And the river goes quick a little bit and slow, quick a little bit and slow. It's unstable. It's quite similar when we pulse, doing the pulse. So from that, we can tell how is your artery goes, and that means the artery coming from your heart indicate how healthy you are. And also, we use these whole, like full, we call that full diagnosis. This is from Chinese doctor. So we do this diagnosis first, and we find out where you need to do acupuncture, and we do that. Same with Western medicine. You go to do your blood pressure. You check your heart rate. You use ECG, check your heart. You use EEG, check your brain. And you use EMG, check your muscle. There are a lot of facility. They can check how is your energy level, how is electricity in your body. Does that make sense here? So, for example, when we have a fetus heartbeat appear on the monitor, we celebrate the beginning of life. But when we see there is no heart activity on the machine, we declare the end of life. So in Western medicine, we measure the electricity. In Chinese medicine, we feel the pulse. We feel there is energy, vital energy start and end. So when we're talking about lost breath in Chinese, and that means the qi has gone. And as the qi is energy, energy is qi. Here is a question. Have you ever go to your GP and your GP arrange a lot of tests, no matter blood test or medical imaging, they detect nothing. The result come back, all good, you're fine, but you still feel terrible. It's only you know how you feel. So you're going to feel uncomfortable, and you talk to your GP, and the GP say, now what? You're going to say, I'm tired, I'm cold. I always feel cold hand, cold feet. I feel tummy uncomfortable when I feel stress. I feel tired every day. So all these language you use describe how is your energy is. You not go to your GP and say, hey, my heart variability, my heart electricity sounds something wrong. You're not using that biological language. Your Western doctor transfer these energetical words into biological words and make you think your biological happens. But nobody show you how is your energy is. So actually you come to a Western Chinese doctor, you gave us energy language, and we gave you energy language back. So when you don't have anything detected, there are usually two common solutions from your doctor. Either they refer you to psychologist or consultant, or they give you medication. It's not about your GP problem. It's about Western medicine. They have been educated in this way. There is no other way for the doctor to help you. They want to help you, but they don't know how to do that. So they're going to refer you to psychology to help you. But that is actually is kind of, in Chinese medicine, is kind of energy healing as well. And also they give medication. For example, if you have high blood pressure, you go to your GP and the GP tests everything. They tell you, we don't know why you got high blood pressure. And you're going to take the pills for the rest of your life. Otherwise, you're going to have other dangerous problem. Imagine how long you take the pills and how much profit you earn for the medical industry. Maybe some benefit in there. So, and why these things happen? Why you not find out anything but you still feel terrible? It's because energy things does not always shows up in the blood test, does not always shows in your medical imaging. Thinking about it, you start feel uncomfortable at the very beginning. Your body is not worse enough to develop pathological change to able to get the machine able to detect. Does that make sense? So that's the first thing. See, if you got sleeping disorder, how the machine tell you why? If you got tired, you can't run properly, how the machine tell you? That is not about the Western medicine problem, it's about the machine. The machine itself is still developing. We have a lot of wonderful machines. We have MRI, we have X-ray, see the bone, we have MRI, see the disc, see the tendon, but you don't have the machines can see everything. That is the current things. And Chinese medicine more than 5,000 years, and we use the pulse, we use the full examination way, we can detect how is the energy. I don't know why, I've been told of that and I've been practiced that, and my patient told me that works. But how the energy works, currently the machine is not able to detect. Maybe they can detect next ticket. Another thing is here. This is, you can see the people I asked ChatGPT generated for me. So you can see these people around, there is a lot of energy that we call that energy field. When we approach to someone, see if we stand this far, you can feel you're safe. When I get you close, you're not feeling safe. That is each one's energy field. Everyone will have our own energy field. And on the acupuncture point, and it's a meridian, currently people start use, like what I mentioned about before, the electricity transmission. But exactly like that, I'm not sure. Just according to the research, they start use this language to describe that. But when you put acupuncture in there, what is our purpose? We want generate the vital energy inside the body to start release energy, and your body can start heal itself. If that way you cannot understand, you can understand like a biology transmission signal get problem there, and you put needle in there that increase the signal so that electricity can transfer properly. And that is the reason we always use the needle is metal, a kind of metal needle. We used to have stone needle like ancient times, but that's been disposed. And currently we use a lot of fan needle. It's thin, but it's all metal. That because the metal can transfer the signal, electric signal. So here, from research, that is a lot of physiology happens when you put needle get in the tissue, how that stimulate the disc, not the disc, the spinal cord, and transfer the signal to a brain, and it can generate a lot of chemicals. So as a patient, you don't have to understand this physiology, but this is Western doctor tell you what happened in there, and they usually can release endorphins and serotonin that will make you feel happy, that make you feel painless, and that is quite similar chemical when you take medication. So here is a comparison when acupuncture application in different country, and that the first one I show you in China, acupuncture and the Chinese medicine is a kind of mainstream medicine. People have problem, they go to see Chinese medicine or they go to see Western medicine. It's their own choice, and is covered by the national health insurance. And is in China, as I mentioned, we have own many Chinese medicine hospital. And in New Zealand, we're not in public hospital yet, but with And also the application is a little bit limited. When are you going to see acupuncture? When you feel pain. But actually we can help more than that. And Australia is getting a little bit better. They mentioned about stress and cancer support. And they do private insurance as well. In United States, they start notice how helpful, how powerful acupuncture. They start to put acupuncture in the public system, but they only can apply in the integrative medicine. And sometimes they practice by physio and not acupuncturist. So it's a little bit different. But they can do that in chronic pain, cancer facility, or anxiety things, and it's covered by some insurance. So what I want to show you this one here, I want to tell you acupuncture can help more than the pain. Like when you feel headache or a lower back pain, yes, you go to see acupuncture, but also some other stuff. If you go to your GP and the GP only can give you medication and you don't want to take the medication forever, you come to us and see if we can have anything to help you. There is a video I want to show you. Yep.
So before I started treatment, I had very poor movement in that left arm. I was basically having to support it to lift it and take it with me. It was difficult to get changed in and out of clothes. I couldn't move my arm above my head. Very poor movement of with my fingers to actually grip stuff, and very little strength in that hand. That was before the treatment.
And right now?
Right now I've got full range of movement, so I can lift my arm right above my head. I can eat with a knife and fork, with a fork in that left hand. I can grip fine, like small objects in that left hand in between each finger. The strength is returning in that hand.
Cool. So in the video, you can see the man. He can move the finger already. In the past, he couldn't. So this is my patient. He is 32 years. He is a New Zealander, and he went to Australia. And he after he come back from Australia, he got a kind of virus hit his brain, and he got live in a hospital for 6 weeks. After come out from the hospital, he still the whole left side couldn't move properly at all, and he can't lift that arm. He has to use the right one to assist that happen. So this is the condition of neurological problem, which acupuncture can help. And that is not only me. There is a movie called Return to Life. You can have a look. This movie is taken in America. It's a talk about how acupuncture help people go stroke, and how is acupuncture help people when return to movement. And in summary, so when we put acupuncture in there, we actually can help your nerve system activation, and we can help the neurotransmitter can transfer through there and then make you to make the movement properly. And also we can improve the blood flow, the circulation, so they can do the healing properly. And also the autonomic system. Autonomic nervous system, we're talking about sympathetic and parasympathetic. Sympathetic is like you sit in a car, you put the accelerator, so your body can, let's do something. And the parasympathetic is like you press the brake, so your body can monitor between two and balance. So if you sympathetic nervous system dominate, you could not relax. You feel anxiety, you feel tired, and you feel difficult when you sleep. And that says a lot of people, when I see my patient, they come in, they tell me, they have difficult sleeping. So that actually there is autonomic nervous system is imbalance. And of course the pain, no matter acute or chronic pain, acupuncture is really helpful. We also in China, we use acupuncture for surgery. That means when you do anesthetic, that's the word, anesthetic, and you don't have to do that much chemical. You can do less chemical to make people feel numbness around this area, so able to do surgery. So we've been used that, and actually that is the case for acupuncture spread to United States. That was 1972, 1970 sometime, when there is a journalist from America. They come to China with American president together, and the journalist got what is that? The problem on the common, appendix. Yes, thank you. They got appendix problem, and the surgery, they didn't use any anesthetic. They just use needles, and they do the surgery. That will surprise them, and that's the time acupuncture transferred to United States, and they start doing the research. So, what kind of condition can acupuncture help? According to WHO, there are 117 disease and conditions. So 28 conditions has been proved, that kind of the statistics number for you to get. So there is on the left side is a category, what kind of category currently acupuncture proved can help. See, if I've seen a lot of people complain about they got either constipation or either diarrhea. They go to see the doctor, they do the colonoscopy, they didn't detect anything, and they just live with that. That is not right to me. You need to do something to help yourself, and only you care about your health. And also the period pain. I'm really angry about that when people talking about period pain, and they go to see a GP, and the GP give them pain medication. If they help, fine. If not help, they're going to give them Marina. Stop them have period. That is totally wrong. They can change their hormone level. They are young. They need have a period to detoxin. That is different from male and to female. That's if you want you artificially stop the periods. That's not natural things, and that is quite common in New Zealand. I have seen a lot of young girls like that. They use a Mirena, and they use pregnancy medication. Stop that. This is wrong. Acupuncture can help that. We can help you have normal period, regular period without pain. And also, we see a lot of hay fever. Hay fever, especially around the windy season. People come in with runny nose and they grab a tissue and say, I got hay fever. It's common, doesn't mean it's normal. And then when you have that, that means your body have chronic inflammation in there. If you ignore that kind of inflammation going to spread your whole body. And that kind of inflammation can affect your joint, can affect your general health, and can affect when you're getting elder, you're more vulnerable, get problem. Chronic inflammation is the main things. And then another thing is about headache. I have seen a lot of people have headache and a migraine, and they are told they can only be managed with medication. No, definitely not. You can come in and we can help you reduce their pain level, and then we can help you get less frequency. So here is two common acupuncture points I would like to tell you. On the left side is Hegu. That is the most popular acupuncture point for you to release your pain. So no matter where you're in pain right now, any one of you sitting right now, you feel anywhere pain? Either neck sore or lower back sore, that kind of thing. You're going to press that. So that is a quite common. That's it between your first and the second hand. So this is the index finger with your thumb between these two bones, and then you're going to press there. If you feel sore, and you're going to press that as much as you can. That will help you a lot of pain. This is the most common acupuncture point for pain. And then we use that for the anesthetic during the surgery. This one is for improve your immune system. Everyone want to do that, eh? So this is called Zhu San Li. And it is on the shin of your leg. Here is the tibia. You find the tibia, and you find the fibula. So these two bones, between these two bones, they're and you're going to feel the bone, the little bone here. You use the forefinger, your own forefinger, and you feel that. If you press that, you feel sore. You're going to press that forever. If you press that, it's going to help you to walk longer. Sorry. It doesn't matter what side. It's if you feel knee pain, it matters. If you want to use acupuncture, this one to improve your immune system, it doesn't matter. You probably want to do both. And this can, if you go to hiking, I like hiking. So if you go hiking about, let's say, 5 kilometers, and you start feel your leg sore, you sit down for a while, press this point, you can go another 5 kilometers. So that is common for improve your immune system. So these 2 points for you to take out today if you don't remember anything I talked today. Eh? That's here. Any question? Yes. We will not help you to change the bone density, and the arthritis itself will not change, but will help you release the pain, release the inflammation. And the things is inflammation, arthritis, the teeth, that means inflammation in there. If we reduce the inflammation and you become arthrosis, that means you have the condition, but you will not feel that much pain. Yeah, and it will help you improve the movement. And then when we in Chinese, the saying goes, when people getting old, their legs getting old first. So if your legs can move much better, you're not feeling old. How many of you sitting here can do deep squats? If you can't, you're going to practice that. When you do deep squat, you feel problem that you need to do something. Don't wait until you cannot do and you start come to do the treatment. Because our body tell you a lot of signs at the very beginning. If you have a little problem, you come in, we solve that, done. If you have really pain and you come in like that will take longer, and then maybe you cannot fully heal. Am I answering your question? Thank you. Any more questions? If not, I'm going to hand it over. Yeah, sorry. Yes, that's common. That's everyone approach is different. So as a medical practitioner, we can see the problem from different perspective, and also acupuncture, they have many different technique. Some people, they like this technique, some people they like the other technique. And yeah, so their approach can be different. Mm-hmm. Sorry? I will not say which one better. I say which one is better for you. If you feel better, that means better. If this technique is good, but it's not work for you, it's not better for you. Sorry. Yes, you can. The thing is, you come for acupuncture, it doesn't mean you can't go any other practitioner. No, not like that. The thing is that we cooperate with your GP, we cooperate with your other practitioner. We work as a team. Like same in China, we as a department in the whole comprehensive public hospital, we assist for people have, for example, have stroke. You still doing the intervene injection, you still take medication, and you still doing acupuncture to help you the whole. Yeah, you're still seeing the physio to help you the whole rehabilitation. So we are one team in the whole medical system. We are not individually. Yeah.
How do you assess someone using non-Western medicine for with a symptom say high blood pressure? How can you assess when that's counteracting what's actually going on? So the blood pressure medication is putting the blood pressure down. How do you assess whether
So you mean when people take medication already and their blood pressure get down, how can I tell they got problem? We can tell from your pulse, from your tongue, because what you take the medication that covers the symptom. Yes, your blood pressure get down, but they not cover the cause, and the cause is still in there for us to detect what happened in there. You're welcome. Acne. Oh, okay. That kind of facial, yes, it helps. But for me personal, I'm not good at that. Yes, it can help. A lot of people use acupuncture to, make them look young, reduce the wrinkles, to work on the skin. Yes. Well, you need to find the right person. Yeah. Okay. Oh, I got some brochure here. So I work at the Birkenhead. Feel free to pick up. Yeah. And we also have pre and post natal care. Yeah. Okay. What do you mean nerve damage? Nerve damage in what kind of degree? Affect the working. So it depends on what kind of nerve problem. Is a central nerve problem in the brain, in the spinal cord, as a peripheral nerve in the leg, in the thing. So whenever we got nerve injury, the nerve itself can accommodate. That means if we have narrow space, for example, if nerve thick like this, when we have compression on the nerve can develop narrow and become thinner and thinner. And it depends on how bad is nerve injury. If you have that, no matter how long you have, either acute or chronic, it depends on how is your state currently. I've seen quite common in my practice when people come in and tell me they can feel hand numbness. They feel, it depends on which finger you feel, either the ulnar nerve or medial nerve or the radial nerve. And it's a nerve problem is come from your neck, or come from your shoulder or elbow or wrist. So that we're going to detect by examination. And if it's from the neck, and there's a peripheral nerve here. And if a central nerve, like we work on, like a stroke, that kind of different things. Am I answer your question? You're welcome. All right. Thank you, everyone.